and welcome back to the Muscle Whisperer with me, Kate Browne. In this episode, I'll be sharing some tips on how to locate the piriformis muscle. So I hope you enjoy, and if you have any comments, please leave them below. Okay, so the best way to show you how to locate it is by doing a little bit of an interactive diagram for you. So I apologise about the pretty basic illustration I've done here, and also thank you to my partner Rich for potentially sacrificing his boxes to have this drawn on him, which will hopefully wash out, but we are not 100%. Anyway, so the way to locate piriformis, or the easiest way, is to locate a couple of points, some bony landmarks. So the first ones, I put X's on here, hopefully you can see all right by the camera angle. And these are locating the PSIS, which is the posterior superior iliac spine. Now that is a bit of a mouthful, and you don't really need to know that term necessarily, but what they are is it's the two bony prominences at the top of the sacrum and sort of at the inner part of the pelvis. So if you follow the crest of the pelvis around, then you'd get to those two bony areas. So that's your first landmark, is the PSIS. The second one would be the coccyx, so the end of the sacrum, and if you just use your fingers, you can gently palpate down the side of the sacrum until you find that area. You don't want to go too far because it feels a bit invasive, but you can roughly find midway along the length of the sacrum, and midway is about where the piriformis attaches, and it actually attaches to the front of the sacral bone rather than the back. So now you kind of know where the level of the piriformis is in regards to the sacrum, and we're going to come out to where it attaches on the lateral side. So this lovely illustration here is the femur, top of the femur, and the greater trochanter, which is that sort of big bony prominence at the top of the femur. So if you feel down your hip, it's that bony sort of bulge on the side of your hip. So if you're palpating on your client, I just use my fingertips and just very gently push going up. You can feel that bony part, the femur. You follow that like a road until you feel where it starts to stop, and you could just end up with your fingers tucked over the top, which is the top of the greater trochanter, that bony part that you can feel here. So the piriformis muscle stretches laterally across the buttocks and attaches to the very top of the greater trochanter, and it's deep to the big gluteus maximus muscle, so that's covering the piriformis, so you'll be working through the gluteus maximus to get to the piriformis. Okay, so now you're ready to try and locate it in a treatment. So I'm going to undrape the leg. Someone asked me actually in a video about draping for the glutes. So when I'm working from the leg up, what I tend to do is tuck the drape into whatever underwear they're wearing, and I think that underwear really kind of dictates what work you're able to do. So in this case, my client is wearing boxer shorts, so I'm going to tuck those up, and they're flexible enough that I can actually push them up comfortably, so that I'm exposing the gluteal area. Sometimes you can't always do that, so you kind of have to work with what you've got, or make suggestions about what sort of underwear they wear to the session to make it easier if you know that you're going to be working in the area. If you can't really push them up much, then I tend to work over the underwear or over the drapes using compressions and release that way rather than using oils on the skin. So it just kind of depends what they're wearing. I also like to just move the hand, because sometimes that becomes a bit of an awkward moment in a massage, that you can see the client kind of wants to move their hand because you're coming into close proximity with it, but they're not sure whether they should. So I just, you know, make that decision easier for them, move their arm so it's out to the side. Also, if it's cold, I will just keep their lower leg covered by the drape as well, so that they're not getting cold. So we've learnt how to locate the piriformis, so that's by locating the PSIS, which is that knobbly part at the top of the sacrum, and then sort of roughly locating how long the sacrum is to the coccyx, and we're looking at about midway that the piriformis comes to. And if we just come up the femur here, just using gentle palpations, we'll feel that knobbly part, the greater trochanter, and we're just going to tuck our fingers onto the top there so we know where the top of the greater trochanter is, and now we have the line for the piriformis muscle. So now we know where it is. I'm just going to keep my fingers over the area. I'm going to let them sink through the thicker gluteus maximus, which is a very thick muscle. We've also got that adipose tissue in the buttocks, so you're going through quite a lot of layers in order to get to a piriformis, and I would encourage you just to do that slowly and just allow your fingers or elbow, whatever tool you're using, to sink down gently rather than pushing down through, because that could cause your client to contract, or it could just be painful, not very nice. And then what I'm going to do is bring the lower leg into flexion, and it's quite nice just to use a little bit of rotation, just gentle rotation, and that helps to mobilize and relax the area, and you'll feel under your fingers things moving, contracting, lengthening, and that actually helps you to get through some of those superficial layers as well, because it allows the area to let go. If you want to feel the fibres of the piriformis contract, then you want to get it to do its action, which is to contract and laterally rotate the legs. So if I bring the lower leg into a bit of lateral rotation already, just bringing that to the midline of the body, I'm going to put my hand there as a support, and I'm just going to ask them just to gently push into my hand, and that's going to contract the piriformis muscle. So you should then feel just the subtle contraction of the piriformis, and you can relax. And as they relax, you actually get a little window as well of softening where you can go deeper into the muscles. That's a nice technique actually in itself. You know, you're finding the muscle, you're locating it, but you're also getting a little bit deeper into the piriformis as well. So yeah, that's about it. That's how you locate piriformis. I hope that was helpful to some of you, and if you have any further comments or questions, let me know and I can answer those as soon as I can. So I really wanted to do a video about how to locate the piriformis, because it comes up all the time in treatment, and yeah, once you know how to locate it properly, it makes your treatment that much easier and also that much more successful. So first of all, the piriformis, its action is to mainly laterally rotate the hip. So that is, if you're standing, that the leg is rotating outwards or laterally, and also when the knee is flexed. So I apologise, you can't really see me properly here, but if the knee is flexed, that it is also abducting the hip as well. So it's lifting the leg out like that. Think of a dog cocking its leg, if you like. So that's its actions. It's also often comes up with the phrase of piriformis syndrome, which is referring to pain in the buttocks and lower back, sometimes travelling down the back of the leg and into the foot, sometimes numbness, sometimes weakness, but that is relating to the piriformis muscle having contracted or spasmed or damaged perhaps, and that causing irritation to the sciatic nerve, which is travelling over, through, or under the piriformis muscle. So not to be confused with actual sciatica, that is a problem to do with the spine and with the vertebrae and the discs. Piriformis syndrome kind of mimics some of the symptoms of sciatica, but is not as serious and is more easily treated for therapists like ourselves. If you have any questions, then please leave them in the comments and I'll answer them as soon as I can. If you enjoyed today's video, then please like, share and subscribe. We look forward to seeing you again soon.